Welcome to Live, Work, Thrive. I'm Makayla Birmingham, Scary Mommy executive producer, and I will be the moderator for tonight's panel. It's back to school season. We should be rejoicing, right? Not exactly. While some are returning to school in person, and it's, a return to long-awaited normalcy. But along with that comes many unknowns, worries, safety protocols, or the lack thereof, depending on where you live. This school year is not the normal we were hoping for, and tonight we're going to dive into all of your questions, concerns, and most importantly, the facts on kids, the COVID-19 Delta variant, and the latest on vaccines. Specifically, we will cover masks, the myths, tips, and how they work to keep kids safe. The Delta variant, how to consider the latest data to make informed decisions. All those rumors about the vaccine for your children who are 12 and your children who are under 12. We're going to dive through all of them and debunk them, so stick around for that section. That is your job. How to help and support our kids through this year of challenges, changes, and the inevitable unexpected twists that are to come. Let's meet our panelists. Tonight we have with us Dr. Hina Talib from the Academy of Pediatrics. She is also a board-certified pediatrician and adolescent medicine specialist, writer, and speaker. She is an associate professor of pediatrics and obstetrics and gynecology and women's health at the Children's Hospital at Montefiore. I'm tired just reading this bio with all of these things that you do. She also directs a fellowship in adolescent medicine, and as I mentioned, is a spokesperson for the Academy of Pediatrics. Dr. Talib is a parent of 2 children and is based in New York. Thank you for being with us tonight, Dr. Talib.
Thank you for having me.
Also with us tonight is Dr. Jenny Radesky. She is a developmental behavioral pediatrician and assistant professor of pediatrics at the University of Michigan Medical School. She received her MD from Harvard Medical School, trained at Seattle's Children's Hospital and Boston Medical Center, and her clinical work focuses on developmental and behavioral conditions in low-income and underserved populations. Jenny, thank you so much for being with us tonight.
Yeah, thanks for having me back.
Before we get started, we have a couple quick reminders for the audience. You can submit your questions in the comments wherever you are watching, regardless of the platform. Enter your question in there, and you may see your question featured later on in the show. You can also join our mailing list so you don't miss out on any of our upcoming virtual events. Visit scarymommy.com/liveworkthrive to sign up and stay in touch. Let's get into tonight's topic. So, Dr. Talib, consensus has emerged this year in favor of bringing as many students as possible back to the classroom. How did the American Academy of Pediatrics and other child experts come to this conclusion?
Yeah, so, the American Academy of Pediatrics feels very strongly that returning our children to in-person school or continuing their in-person school from last year is vitally important for not only their education, but their emotional health and even their physical health and development. School serves as a touch point for so many different things, probably too many things. And they have been disconnected from those services and those touch points. And it is best to be delivered in person. That being said, we understand that there are a lot of questions that we need to answer and help support, make that feel safe, because without safety, all of those other things, including education, development, social, emotional skills, healthcare visits, it all, it's the base layer. So I'm happy to get into that more with you tonight.
Well, that makes a lot of sense. Now, Dr. Radesky, you specialize in working with children with autism, ADHD, and other developmental delays. Tell us a little bit about how the loss of in-person learning has impacted these kids and why is it so important that they get back to school?
Yeah, there's so many different ways that families described this last year being just too difficult and even feeling like a major loss in many ways. Now,
I lost her audio. I don't know if I can hear Dr. Radesky. Doctor, are you still with us? Can you hear me okay? Oh, there you go. Now we can hear you.
Can you hear me?
Yes.
Okay.
Okay.
All right. Sorry about that.
No problem.
So I was saying that my personal experience caring for kids with developmental differences was that it was an incredibly difficult year. I had a few patients who thrived at home, but most of them from the loss of their school therapies, from their just not feeling as understood. They didn't have the relationships of school where people kind of get them and see them for who they are and meet them where they're at and help them learn right at their own pace. That was really dysregulating for lots of kids. So I was hearing a lot about sleep problems, more tantrums, more just shutting down and seeming to lose their spark. But across all kids, I mean, what was such a tragedy about last year was that the scale of it was just millions and millions of kids. And the duration of it is that it was, up to 18 months for a lot of kids without that structure, stimulation, excitement, and sense of self that they got from school. So, and it's not just kids with developmental differences. So the estimates from McKinsey are that across the board, kids are about 5 months behind in math and 4 months behind in reading compared to what we would expect them to be if they had been in school during this time. So kids are going to be entering school feeling less confident, feeling like, I don't even know where I'm at. Am I at a third grade level? I'm going to give this a try. And I think teachers know that. They're going to be more patient. Parents are going to be more patient and say, I'm just going to give this our best shot. But I want parents to approach this year with a sense of, okay, we're just going to all give this a try together. It's not going to feel perfect. We're not going to put tons of pressure for academic success. But the difference with kids returning to in-person school is such a dramatic improvement that I want parents to approach that with this year with that hope that, with the right sort of safety precautions, we can really make this work and help reduce the amount of time that kids are out of school.
I think that's you've just kind of nailed it there. This element of hope and excitement about going back is so reassuring. But then at the same time, just as we're buying the school supplies, we read an article about a young child in an ICU and you start to have heart palpitations about, sending your kid back into the world. So Dr. Talib, ground us in some data here. Do the actual rates of in-school transmission of COVID-19 remain low, or has that changed?
So we felt really fortunate that we had some studies pre-Delta that showed low in-school transmission when you use sort of all of our layered mitigation approaches. And that was really reassuring and sort of informed our return to school thinking. But then Delta hit and the summer hit. And so it is true that, children, we are seeing more rates of infection. We're seeing more hospitalizations. But it's too early for us to have data to show whether in-school transmission has increased since the start of this school year. Some places we have a week, and some places we have a couple of weeks. We are going to keep an eye out for this data as it comes in. Now, I can tell you my pediatrician colleagues, my pediatrician mom friends in different locations around the country are sharing different stories. In places where you don't have or didn't have all of the tools in our toolbox to kind of protect our children, including masks, universal masking policies, ventilation, testing, all of these things. There have been reports of in-school transmission. And in other places where potentially, again, we're only looking at a week, we haven't so far. So we need to wait. We need to wait before we know for sure about in-school transmission post-Delta. But a lot of eyes are looking at it, and common sense tells us, Delta is more transmissible. So if it finds its way into your school, it is likely to transmit in a way that it may not have pre-Delta. So common sense does tell us to, have our antennae up and to use all of our tools in the toolbox. Whether every school is able to or is willing to is another story.
But I want to underscore that anxiety that you are talking about, that parents are feeling, and I totally felt it too. I mean, during the summer, I felt these huge ups and downs of hope and then like despair and dread, even at times, to feel like I have no choice. Like my children, my own personal children, did not thrive last year on remote learning. I'm just starting to see the spark back. Their kind of little personalities come back. They are, the kids that I was able to play with and hang out with this summer, I'm like, yes, we need to sustain this. So for me, for my family, I really went through this period of saying, I was following the data like obsessively to say, is this as contagious as chickenpox? Am I okay with sending my kids to school with like, their flimsy cloth masks? Like, how's this going to work out? I'm in Ann Arbor Public Schools. I was grateful that they did, masking that made me feel better. And really it came down to is letting go, accepting my own anxiety and feeling like some trust in the systems that I was working within, right? Knowing the principal, knowing the families that I was talking to. And I want to emphasize that because I don't want to pretend that parents are going to be going into this school year like, yeah, we can do this. It's totally going to be great. You're going to feel knots in your stomach. You're going to feel uncertainties. We're all going through that together. And so having some ways that you can connect with other parents to kind of process that together, having ways that you are in, communication with your school, or even like I have one family who was upset because theirs is the only child masking in their school. And I said, you could call your county public health, if you wanted to, and really talk about how hard this is, because you need to feel like there's some action you can take, or you're going to feel frozen.
Yeah, I mean, well, you just mentioned something there, Jenny, that I want to clarify. Is the Delta variant as contagious as chickenpox? Is that a thing? Because
So
now I'm even more
when
worried.
they and you can correct me if you've heard otherwise, but when they've done the transmissibility studies, they create this R naught number, this number of the amount of different people you are likely to infect of a given case of an infectious disease. And when they plot these out early, when they're just learning about a virus or a strain of a virus, there's usually kind of a bar of uncertainty. But the bar of uncertainty for the initial strain was, I don't know which way I'm going on viewers' screens, but it was like down here, kind of like closer to like flu. It was more transmissible than SARS, but it was, the new strain is like up here. And it's wider, so it part of it covers the chickenpox transmissibility. So it's possible it's less than chickenpox, but it really made me think as a parent, like, okay, what am I going to do to help my kids get ready for this year, help them keep their masks on, help them, take their masks off outside, but not start, picking their nose and other things that, my 8-year-old might do sometimes. So that's, those were the kind of extra layers of caution that made me feel better, as a parent, knowing this is going to be out there. And hopefully it'll be mild for a lot of kids. But, as we're seeing with ICUs getting more filled up, there's a proportion of kids that are having a really hard time with it.
So yeah, let's talk about some of those numbers. I believe it was earlier today, the AAP reported that last week, this week, 250,000 kids tested positive. Now that seems like a dramatic number. Dr. Tlaib, maybe you could put that into perspective for us a little bit, and also talk about out of that group, how are the serious illnesses and deaths, lining up with that 250,000?
So it was a jump for sure. We've used the word exponential at this point because it is quite a jump of an increased absolute number of cases, as well as hospitalizations. So they're getting close to as high as it was in our winter surge time, and approaching that, and we're likely to be overtaking that. And so, again, these are data that make us, I'm a mom, I'm an anxious mom, and it's hard to look at this data. So it is reflective of the Delta variant. It's reflective that variant is 2 to 3 times more transmissible than what we were facing with our prior surges. But going back to what Jenny said, as an anxious mom, being prepared playing out the scenarios, over communicating with your school systems, even your classrooms. These things are in our control, and whatever is in our control, we can and should do. It makes us feel better, and it makes me feel better. And a lot of these things that we can do, even if other people aren't, like masking. If you're, a question I get so often is what Jenny mentioned, where my kid is the only kid or in the minority of kids who will be masking in their mask optional school environment. And I always remind people that mask is still offering a layer of protection for their own child, even if their own child is the only one. Ideally, universal masking, as the AAP recommends, but that may be out of our hands. I love what Jenny said about advocating and using your voice, because that's another outlet for our anxiety, and it does make us feel better, and we can affect change. And so that's important too. But there are so many tools in the toolbox, and we can talk about some of the other ones too.
Well, I think you raised a good point there about, relying on your community, and whether that be your local health and safety officials, or whether that's, the group of moms that you interact with at drop off, sharing information about, I found a place, where you can get a COVID test overnight. Actually, just before we got started, Dr. Talib gave me a hot tip for the New York circuit here, where I stood in a line yesterday for an hour trying to get a test for my kids to go back to school. So those kinds of resources that we can share with each other as moms help bring that anxiety down. Maybe you're feeling stressed out about something, and, maybe talking to another mom about it might help that, that mom feel better about something. And then also, we don't want this to be hush hush. If someone, does develop symptoms, it can't be lice where you're like, I'm not telling anybody that we were patient zero over here, like we can't be in that mentality, because this is deadly, right? And so we need to be really open and talking to our fellow parents out there about, the ways that we're so in this together that we just have to get everything out in the open. Would you say that's fair?
100%.
Yes, should be, we have to be able to talk to each other about this, and it's hard. We have to be able to ask each other, are you vaccinated? And it's hard. It's a very hard question, but it's important, if you're going to be around, vaccine ineligible children, that we know and that we feel comfortable asking, and we feel comfortable asking about, exposures and about, and if your child does have COVID-19, it should not be stigmatized. Like we need to very openly, in fact, our community should rally around families in the classroom that may have it and offer them support. It's not easy, and it does, seem to be going through the household. Again, it's more transmissible than it was last year. So we do need to take care of each other and lift each other up as we see this data coming forth. But remember also that the CDC put out some studies this week that kind of displayed for us how unequal these rates of infections and hospitalizations are in different areas where you have the greater population or the greater community be either higher or lower in their vaccination status. They painted it, it's pretty clear. It's pretty darn clear that the way to protect our vaccine ineligible children and adolescents is to have a higher community rate of vaccinations.
Yes, it's up to us, right? It's up to us. We're the first layer of defense. That is such a great point. And I love what you said about, normalizing these questions about, are you vaccinated? Like if everyone would just ask each other that, it would become so much easier, and it wouldn't be, it would be like take your shoes off at the front door. That's like in my house. You don't walk in my house with your shoes on. But now it's, are you vaxxed? Because you're not coming across the threshold if you're not vaxxed. So tonight's event is presented by Noggin, the learning app from the experts at Nick Jr. And actually Dr. Radesky is on their scientific advisory board. And for our Noggin moment, we are bringing you questions from the real life Scary Mommy audience. Here is one from Monique. She asks, how likely is it for schools to have to go remote with the variants? Also, would Dr. Talib send her own kids to school and feel comfortable that they are safe? So Dr. Talib, Monique, wants to know your business here. Tell us how you're feeling. You said you're an anxious mom. So are you sending your two back to school, and how are you feeling about it?
So I am sending my 3 and my 5-year-olds back to school, one in preschool, one in a K through 12 environment. And I am privileged to be in a location where in New York City, where we have a great vaccination rate for adults. My school has mandated vaccines for all vaccine eligible students and staff. So that's a pretty heavy layer, like the base layer. The base layer is really strong, and that gives me a lot of comfort. So that's my personal answer. But my personal answer, I know, is not, applicable to a lot of people because there's just so many different ranges of what a school can do. They may want to do some things, but there are limitations to physical limitations, space limitations, ventilation limitations. And so and then also every family is different. You may have a family where you have a immunocompromised family member. You may have a family where a child has a health condition where your risk tolerance may be different. You may have more worry, and you may be, reasonably, you have more worry. And then you have childcare needs. We need childcare. If we are working outside of the home, as I am as a pediatrician mom, I've been outside of the home, this whole pandemic, and it was very, very hard when there was no option. And I mean, to tears, daily tears about, I don't know how to do this. And I've heard from, folks who are trying to keep their income, and, things have changed in terms of income as well, and support from the government in terms of our COVID relief. And so this is very real, and we have to look at the whole picture when we're trying to make our back to school decisions. I'm not remembering the first part of the question because I jumped in on what I would do for my kids.
Oh, she was asking how likely is it for schools to have to go back to remote learning due to the surge of the Delta variant?
Well, I mean, the quarantine dance that's been happening at some of these schools that opened already in the South and the Southeast it's like head scratching, the numbers of kids who have had to be quarantined. And then they've switched to, some of those schools were prepared and had remote learning for that time that the children were absent to be in quarantine. So, similar to last year, I think we are facing uncertainty. We have to be flexible. We have to work with our schools. The absolute numbers of when a school may shut down, I wish these were things that I could just say, this is what it is. And like, if you have this many transmissions, your school will shut down. We don't have that. And it's going to be different for different school environments, but you can ask your schools, what are your plans? And for me, I love to know these things. Like, what are our guardrails? What are our plans for when we may shut down? There is some, if what we can do is, continue to talk to our school community members about vaccination, because I think that is our thickest, heaviest layer, our base layer, I like to say, to hopefully prevent some of these in-school transmissions as well as quarantines. So I don't know. I can't predict the future that for any given school that it may not shut down. We may have quarantines that result in remote learning, but we know so much more than we did last year. And we have the vaccine, and we didn't have that last year. Yes, Delta is a big whopping, like, in our face, oh my God. But I do think that if using what we learned last year and using it effectively, using all of our layers, our tools, we can safely have children in school. I feel that.
And I think, here's a couple questions to ask yourself. If parents are still feeling tortured about this decision of returning to school. And I can tell you, like, I've had the same sort of feelings of like, could I handle, like, what are the options? Could I handle remote learning with my kids this year if I really wanted to accept zero risk at all? Because all the mitigation strategies we're talking about, masking, testing, vaccination, ventilation, they can really minimize the risk of in-school transmission. They can't eliminate it. So if you're a family where you want zero risk, and your child actually did fine on remote learning. I have plenty, I have a handful of patients who are in that situation, and I'm totally fine with them continuing on remote learning because it really was not damaging to that individual child's mental health or social emotional well-being. But I think a lot of parents are in the camp of last year was really hard. I don't want to redo that. I can accept a little bit of risk, and I'm going to rely on my trust in the relationships I have with this school. And I'll be honest, like the day before sending, my kids have been in school for 6 days. It's going fine so far. But like at drop off, I just saw all the kids like wearing their masks, doing fine, excited to see each other. The teacher was really transparent about, we're going to be out on yoga mats for breaks. We're going to do this. I grilled my kids when they got home about like, what did you do? And who did you play with? And did you share food? And like, I was like, this is going fine. This is going fine. I was like ready to knock on any wood, but it was such a relief to know that like, okay, things are chugging forward. The question about how likely is it to quarantine totally depends on masking. So one of the reasons we argue for masking in schools is to reduce the likelihood that your kids have to go into quarantine or remote learning. And so that's a very practical argument for why masks are going to be helpful this year.
Okay, we got to dive into the masking thing because
Yeah.
everyone has the panties in a knot over the masking, and I'm sick of it. Okay, so let's level set here. Facts, only the facts. I'm going to leave my personal opinion over here next to my mask.
Yep.
Okay. So Dr. Talib, can we review for our audience why masks for children and how they provide an added layer of protection against COVID-19? Just give us a little quick scientific, child, teacher, what's happening with the aerosols?
It's a barrier. It's a barrier for the virus. It is effective. Children have shown us that they are able to wear these masks. And especially when the adults around them are wearing these masks, they have adapted really well. My own children are 3 and 5. They wore masks in their preschool all of last year. They're really good maskers. You have to remind them sometimes to take it off, which is a little bit awkward, but that's where we're at right now. And I think that, I feel so, it keeps me up at night. It makes me so upset that this has become such a hot button issue. One, because it's a great barrier and it helps to decrease the transmission for the person who's wearing it. If they are the infected person, it is really helpful at cutting down the transmission of that virus from them to other people. And for everyone else, it also helps reduce infection risk if you're wearing the mask and you're exposed. So what really upsets me is we should be beyond this. We should now be in the minutia of what testing protocols should there be in place? How do we increase access to testing so that all families and students, know what the plan is and have access to whatever that plan then is. We should be in the minutia of ventilation, of space for schools, like if we need to build out, and because of all this attention on masking and the debate around it, I feel like it's taken away from other strategies that could have been had more time and money and effort spent on. So that's another reason why I guess I brought my opinion into this. Sorry, I just couldn't do it.
But I mean, let's debunk a few of the things that are commonly said that are published in our in opinion pieces and things like that. So one is
Dr. Radesky, I think this I know what you might be saying, and it's just a question right from our audience here.
Okay.
But I want to hit you with this one
from
Megan, who is in the Scary Mommy audience, and we hear this one so often. She asks, I would really like to learn why people keep saying masks are not safe for children to wear and whether or not it's true. It's like the number one argument, and it seems ridiculous to me.
Right, baffles us too.
What is the deal? Is there any harm, developmental, cognitive, language? Right. Is there any harm happening to these children with the masks?
So the theoretical reason that people are bringing up this concern is that kids do rely a lot on face-to-face interactions to develop language, cognitive, and social skills. But your mouth then your nose are only part of your face. They're only part of your body that expresses, as I'm doing right now with my gesturing, a lot of your emotion, a lot of your nonverbal communication. So one of the real criticisms I have of some of these saying that like, oh, it's blocking kids' social interaction is like, there's so much more to interact with even when you're an infant. They're looking at they're listening to your voice tone. They're watching your eyes. Your eyes have like 30 muscles around them that are constantly moving to express emotion. And you actually express more emotion through your eyes than you do through your mouth. That's why we want my patients with autism to look more at the eyes than the mouth. But eyes are overwhelming to kids with autism because they move so much and they're unpredictable. So that's one thing, is that you express so much with your eyes, with your body language. And it's actually flexing some new muscles for kids, that they have to pay attention to all those nonverbals in the classroom, not just relying on watching someone's mouth, which a lot of kids don't. Well, let's talk about the kids with special needs who might. So a child with apraxia, who with their speech pathologist needs to do prompt-based therapy to see someone's mouth. Well, they can use a different type of mask. They maybe could do extra testing to have maskless time together. Like, those are individual situations you can totally negotiate with your special education team or your speech pathologist. What about kids who are deaf and hard of hearing? Yes, absolutely. They should be using other approaches so they can do lip reading. There's no evidence, there's no good published studies linking mask wearing with any social, emotional, cognitive, or language delays. So I did some digging into this literature, like, well, what are people sharing on social media? There were a couple of really poorly designed studies released this spring looking at like carbon dioxide levels in children's masks, that was published in JAMA Pediatrics and then rescinded. What's the word? Retracted.
Mm-hmm.
Like, basically, there was so much criticism of the way that they designed this. And I read it and I was like, how did they accept this? This is like, really questionable science. But I think people are so pent up about this issue that it sometimes drives you to publish stuff that, isn't the best research. There's been, there's this one article from Germany, like, cited about like people having headaches and people having cognitive issues. Let's be honest, like, as a pediatrician and all the pediatricians I've talked to, what we heard from families last year was not about masks causing headaches, cognitive issues, language delays. What we heard of was that school closing was making kids crazy, that it was making kids exhausted, depressed, anxious, all these other things. It was making parents depressed and anxious too. When kids went back to school with masks on, so many of those things improved. So that like argues against the whole point of masks being the problem, right? So I really also want to say, it's not just the American Academy of Pediatrics, the American Speech and Hearing Association, ASHA. These speech pathologists are just bulldogs. Like, they will go after anything that they're worried is worsening kids' language development, TV, mobile devices, all this other stuff. They support masking because health comes first. And they know that kids can accommodate in lots of different ways when they can't see a mouth. But they also know, take the mask off at lunchtime, recess, outdoors. You're going to see faces then. Take it off during, times with your family when you're going to get lots of that face-to-face time. So those are my scientific reasons why I, as a mom, I, as a clinician, I do not worry about developmental effects of mask wearing. I agree, let's get better studies on it, but I would love for the misinformation and the kind of acceleration of the drama on social media platforms to just kind of quiet down and stop making parents' choices harder. Because unfortunately, that's kind of what gets accelerated today. And we're all exhausted, and we probably all need a little bit less consuming the news that kind of just riles us up. And I'd encourage parents to maybe like figure out which news sources just feel calm and reasonable, and like stick with those so that you're not, clickbaiting on stuff that you're like, oh no, I knew I was damaging my child. Like, that's not what we need right now.
All right. So I'm going to sum this up.
Yeah.
Ramp it down with the drama, everybody.
Mhm.
Okay.
Mhm.
We have better, more urgent things to spend our energy on. Masks protect you and others from dying of COVID. And there's no harmful effects from a mask on a child. The speech community, the language community, the pediatricians of America agree. All right, so we've solved this now. Let's please move on from the masks, everyone. Those are the facts. And we're going to get into another hot topic here. So much to cover, the breakthrough infections, okay? This one's got everyone, more heart palpitations coming, right? Huge consideration for vaccinated parents with children not yet eligible for the vaccine. All right, we had this brief moment of vaccine. Oh, I went to a club indoors, it was all fun. And then that was 2 weeks of the summer. And then boom, party's over. Now you can get COVID even though you've been vaccinated. Dr. Radesky, tell us, how prevalent are these breakthrough infections for vaccinated folks?
So they're still less common than being protected by the vaccine, which is great to hear. I've heard estimates that are kind of 5-6%, still pretty small if you're vaccinated. And that's because we have great innate immune responses that are going to kind of detect the virus when it enters your system and kind of react and take care of it. Then there's some cases that get the breakthrough infection. And the thing that's worrisome is that they do have high viral loads in their noses and their throat. And so that's why I do agree with Dr. Tlaib that having some increased testing would be helpful for those of us who are vaccinated and we wonder, should I be hanging out with grandma this week? Should I be going to visit my friend whose child has cystic fibrosis or sickle cell disease or something else that can make them at higher risk? So I love that Washtenaw County, where I am in Michigan, provides free rapid antigen testing kits to families with unvaccinated children. We get them at the YMCA, actually. And so I have done probably 20 in the past 3 months on my kids, my families, my in-laws, because I just want that reassurance. I know they're not as perfect as the PCR tests, right? But they are something, another tool to help us feel like, am I putting someone else at risk? Is it okay to send my kids to school this week, even though one of them woke up kind of stuffy? And is it hay fever? Is it, is this COVID?
So you mentioned the rapid test, and I think that's something that a lot of parents want to know more about. You can get them now at most pharmacies. They're pretty affordable. I bought one recently. I think there was 2 in a box for $23 or something. So, not too bad. Dr. Tlaib, tell us why no school will accept a rapid test. You got to do the PCR test, the hardcore lab results. How reliable is a rapid, and under what circumstances it is a useful tool?
So the PCR is most helpful as a screening test. And that means because it is most helpful in being able to catch an asymptomatic case more so than a rapid test where you may have a false positive. If you are I think there is value for these rapid tests. And honestly, I think their value is also wrapped up in parent anxiety or just good, citizen anxiety related to we want to find out as quickly as we can if it's allergies or if it's something more. And take an extra, bit of precaution if you are going to be around somebody who it would be not, like grandparents or immunocompromised people or unvaccinated children. And so I think that the PCR testing, you're going to see that they are going to be used more and more for screening. So the back to school COVID test often is being asked to be a PCR test. Mm-hmm. And then if a school has the ability to, remember, there are a lot of schools, this is a big ask, it's expensive. But there are some schools that are doing weekly or every other week PCR testing, and that is used for screening. There are no really good guidelines for what community rate you must be at to consider, what frequency of testing you might do as a school. The CDC had some information regarding that, but it's a little unclear, and I don't think it's necessarily fair to say all schools should be doing it one way or the other when they may or may not be able to. The rapid test, I bought some too. I have that $23 2 in a kit one as well. I think that what Jennings County did is a model for what all places should be doing. We shouldn't have to pay for these. They should be freely accessible because they are, if you are feeling sick, if you have symptoms, it's a good first test to do to figure out what your next step might be and whether you might change your behavior. I actually think, I'm actually really hopeful that schools could be of the safest places for children to be riding out this Delta surge when they put all these like mitigation layers that we've talked about in place. Because in a school setting that is able to do testing, that is able to have universal masking, that is able to ask, the maximal number of people to be vaccinated, you've created a very safe space for children. And actually the like entree point for infections in the school is the community. And it's kind of what we're doing outside of the community and what we're bringing into the school. So testing has a role in protecting what's coming into the school and then protecting what might be transmitting in the school. Yes, I do wish that we had more access, just like Jenny does, which is amazing because we're sitting here still trying to figure out where to get our kids tested, which is crazy.
So I think, yes, so many tests. And later I'm going to ask you too about how far into my nose I have to do this thing, because I also have had like 25 tests in the past 2 weeks for work and various places I've gone. Sometimes the nurse put it up into the brain. Sometimes it's just down here. And I'm like, when you come back, do that one more time, get a good dig. I want to make sure that they're getting an accurate, but it's never the same. So that's for another show. We got to talk about the vaccine for the children because we're still waiting. Anyone with a child under 12, those kids are not yet eligible. What is the scoop? I feel like Dr. Talib, you gave me a little preview of the AAP had some word on the street about when the children under 12 will be eligible. Can either of you share any updates on the estimated date when this is going to be happening?
God, from your lips to God's ears. I mean, we are waiting. We have heard from folks who are involved in the Pfizer trials that data will be submitted this month, which is September. After that happens, and that sounds that is what I'm hearing from the American Academy of Pediatrics, that's what I'm hearing from investigators related to this trial. After that happens, there's a couple of flex points of I'm not sure when will the FDA have their meetings to review the data? I've heard weeks, I've heard 6 to 8 weeks. Certainly there's going to be pressure. There's going to be
Halloween happening this year? Are we doing trick-or-treating? Halloween is my day. Dr.
I have heard some people say that it is possible. It is within the realm of possibility that we may have this vaccine by Halloween for these younger kids.
Don't make me do
but
that.
I have heard that it's a bar, and we may not have it for them until the month after.
I tell you what, last year I made a chute from the porch going down to the sidewalk. I got a pipe, put the candy down there, and what did I do? Smash my hand and cut myself on the pipe from the sharp edge. Because it's like for plumbing, it's not supposed to be for children. Anyway, so maybe by Halloween, this is good news. We are hopeful. And on this note, I want to talk about some of the myths because there are so many things going around. I'm hearing from fellow moms. And Dr. Radesky, I want you to help us separate myth and separate fact from fiction.
Yep.
We're hearing people talking about this link between fertility disruption on young children.
Yeah.
What's the deal here? Is this fake news? Is there any associated risk impacting future fertility?
So there is no evidence of any impact on future fertility. Dr. Talib, you can correct me if I'm wrong. I do know there was conversations amongst women after getting their vaccines about being like, that was the heaviest period I've ever gotten, or, what sort of effect did it have on the, lining of the uterus? For some reason, I think because it is affecting the reproductive system, perhaps in that way, there was concern, like, how is this going to just mess with fertility? But there's just been zero evidence of that. And there's just not a mechanism for why that would happen. So like with the rarely reported side effect in young men, especially of myocarditis, like there's a clear reason, because the immune reaction to the protein in the vaccine is cross-reacting with a heart protein. And so we still think the benefits outweigh the risks because no one has had any long-standing problems from that. A few admissions to the hospital, some monitoring, and it self-resolved. And the risk of myocarditis is much higher from COVID itself. In fact, many people have had really bad heart inflammation, heart failure from COVID infection. So without that sort of mechanism, it's really hard to kind of debunk, other than saying there's no evidence. Dr. Tlaib, do you have any other kind of reassurance?
I get this question all the time, and I think it's because teens are going through puberty in front of our eyes, especially even more so in this last year because they were home more, and it's just on people's minds. Fertility is always something that comes up as a question, I think, on parents' minds. And it comes from a place of love and concern. And I'm happy to say that this is not something that we need to worry about for our, for the vaccine having an effect on our child's future fertility. There was actually a piece of misinformation that originated this myth, and then it permeated through all sorts of media. We can actually trace back to like the report that came out that I think made people think about it. Yes, the menstrual cycle is a vital sign. So if you, if you have stress, if you gain or lose a few pounds, if you lose nutrition, or if you face an illness, or if you feel a little bit unwell from a vaccine for a day, which is a known side effect, all of these things can affect a menstrual cycle. And so we found that a menstrual cycle may be affected by this, and then it sort of returns to normal. But we don't even, this is anecdotal, and it's with people who are paying attention to their menstrual cycles. It could be real, but we don't have data yet to say that there is an effect. But I would believe it because, again, the menstrual cycle is sensitive to kind of anything that's happening in your body. But future fertility, puberty itself, whether you're going to block them from getting their first period, none of that is something that we need to worry about. And honestly, the fertility is something that is personally important to me and something that I counsel girls on as a teen pediatric and adolescent gynecologist in working with teens. And so hopefully I can be reassuring and let you know that it's not one we need to worry about. And the myocarditis question, I get that a lot too. And I think that, it's important to know that the median number of days in the hospital for these children is 1 day. And all but, 98% of them, the only medication they needed was an NSAID like ibuprofen, which is like Motrin or Advil, and only 2% needed a medication beyond that. And so these are really reassuring data. And just like Jenny said, 17 times worse heart effects when you have COVID disease or COVID infection than from the vaccine. So really outweigh the benefits really outweigh the risks here.
One more time, everybody. The benefits of the vaccine far outweigh 17 times not getting it. Periods are a vital sign. I want that line on a t-shirt.
I love that.
My period is a vital sign. Hi. Yeah, I'm stressed. Yeah, I'm fighting off. I'm building antibodies. Yeah, period knows about it. Period is the bomb. Okay. So great. Future fertility is fine. Everyone out there, it's fine. Stop worrying about this. Get your child under 12 vaccinated so that my child who's turning 12 on Monday, who's getting the thing at 9 a.m. on the day of her birthday, can be around your kid and not bring home anything to me because I don't have time for any COVID right now. Okay. So here's a question from our audience. This is a biggie. Okay. This is, on this idea of struggling with those who don't share our views. Okay. We have a question here from our Instagram audience from Bridget. She asks, anything that could help ease the mind of a spouse that is not on board with vaccinating our young children once it is approved. It has been the elephant in the room since vaccines rolled out for adults. So, Dr. Radesky, what do we say to our spouse, our friend, not naming names, but you know who you are out there who doesn't want to get this thing? What do you say in a non-judgmental way? Don't want to argue. Don't want to break up any families, but
No.
What do you say to get these people to get the shot?
I'm sure that this listener has probably already tried this, but some non-judgmental open inquiry, which is like, tell me more about that. What are you thinking? I'm totally like open to you. I'm not going to react in the moment. I'm not going to jump down your throat and tell you that you're, stupid or anything like that. Like that sort of open inquiry is sometimes hard to self-regulate through when someone says something to you don't agree with, but really just try to be able to listen and process it, because you'll get a lot of clues within those responses. You might get clues like, I'm really worried about my child's health because I don't want some sort of side effect, because I don't think this has been studied enough. That's one common thing. So you can use that nugget of, this person is concerned about the child's health, kind of then talking more about, you don't want to use scare tactics, but a lot of children are being infected right now. It's 26% of the number of new US cases. Like that's so dramatically higher than what it was before. It is so disappointing at this point in the pandemic that we are now watching this start to attack our kids, basically. I mean, that was the grief that I was feeling as watching these numbers go up, to be like, really? Like the variant just decided that now it's gonna hit kids when it didn't before, and all of our calculus is changed. So dealing with that anger, that disappointment, that feeling, because a lot of people, and I don't want to generalize with genders, but I know with my own husband, stress comes up, it's shut down. It's like, nope, I'm just not doing it. Right. So in order to get a little bit of flexibility from that person, you have to listen, kind of explore different options, give them a little bit more information. Maybe it's from a podcast from dads. Maybe it's their favorite comedian. Maybe it's their favorite sports star. Maybe it's something else that's going to break into those cracks of uncertainty, because we all have them. We're all kind of working through the data the best we can.
That is a great point. Do you either of you have any podcasts to recommend to a friend who's trying to not get the vaccine because of a heart-related concern? Who do I send them to?
I don't have off the top of my head. I'll look them up and you can post them.
Yeah, we'll post them. We're going to post
Yes.
also, Dr. Talib has some resources from the Academy of Pediatrics, and we're going to post after tonight's show. We're going to put that up on our site under the event for this conversation. So check that out. We'll get some recommendations there of resources, because I know of many people out there struggling with a family member or a close friend who they really want to see get vaccinated. And it's a tough conversation, and it's really stressful on top of all the other stress that we all have. So let's now touch on quickly, before we go, some questions from our audience. There are so many. I have to say this topic has probably more questions than any other topic. Dr. Radesky, masks. What do you do at lunchtime? If you can't go outside, what is the safest way for kids to eat lunch?
So I'll be quick just so we can get to as many as possible, but teaching kids to keep them on the ears and pull them down and eat like you're on an airplane. And then putting them back up, I don't want kids to be rushing to eat, but that they are, really just kind of pulling down, eating, and, putting them back up as soon as they're done. That's the best we can do.
Good hack. Okay. Pull it down. You're going to come home with the mustard and ketchup all over the masks, but that's fine.
You can practice at home and do it in the least messy, but, most efficient way.
Ask your schools about ventilation in the classroom, in the cafeteria or wherever they're eating, is another tip that I have, but it's a small part of their overall day in school. And so testing other things that we are doing can give us some comfort that little bit of the day where they, are taking their masks down and eating will hopefully be offset.
Got it. Okay. So if a district is not requiring masks and my child is the only one in his class wearing a mask, will that actually protect him? Dr. Radesky, what do you say to this parent?
Yep, it'll do something. And you can talk to other parents. You can see where the child is seated in the room. There's different things you can do to mitigate risk, but yes, it's still worth doing.
A wholehearted yes. Yes, it's in your control, and we can flex that. We can do it.
Okay, here's one about vaccine trials. What is the status of the child vaccine trials? Has there been any updates? When might we hear an update? So that's a good point for anyone who's feeling hesitant. Maybe Dr. Radesky could just give us kind of a brief kind of summary of all the things that go into these vaccines before they get into a child's arm.
Right. Well, they've gone through phase 1, 2, 3 trials. So these are these standardized ways that we evaluate vaccines for response and side effects. So we're in the kind of last phase in children. The data should be ready late September, early October. That's why we're hoping that by Hollywood, I almost said Halloween, we will have something. But it is, for 12 and up, we still are not as vaccinated as we could be. And this is a really important part of our population to be protecting. So just like you, I'm taking my 11-year-old, he turns 12 in 12 days. He's going to get it probably right after school.
So 12 million adolescents have been vaccinated for their first shot. And that's great. That's a lot of adolescents. It's almost half of adolescents that age group. Which is great, but more like 30 to 40% have had both of their shots in that age group. And these numbers are, that's like of in all of the United States, but they vary so much by region too.
So that number seems a little low to me, across the country. How much further ahead would we be if that adolescent population and soon our younger ones got that number up to like 70%? What would that mean for our quarantining and our closures and our getting back to normal life?
It would mean only good things.
Every bit helps, right?
Because less children hospitalized, and it would mean less child deaths. Children are not supposed to die. And this vaccine, that is one thing that it is super effective at. And we'll see the data that comes for the younger ones, but preventing hospitalization and death it's like, that's what it does.
Right. These teens are babysitters. These teens are, working at places in the community. So they're part of community transmission. And the lower your community transmission, the safer the schools are. And and the lower the community transmission, the fewer kids get sick, the fewer kids wind up on ventilators and getting severely ill. So that's why, as pediatricians, we're like screaming from the rooftops for people to get vaccinated, because we just don't want to see any more kids, getting admitted. That it's going to keep happening, but it's really why we're kind of advocating for this to be a community process of everyone kind of working and seeing it as part of our duty to protect each other. It's been a really hard thing for Americans to do, I know, and everyone's exhausted and wishing this was over, but it is unfortunately a time of another surge where we really can do a bunch to both protect kids and the families that they may be bringing COVID back home to.
I mean, if anyone has ever had to install a rear-facing car seat in their car, it's way harder than walking in and getting this thing. Both life-saving. One takes literally 30 seconds and you're done. Car seat, forget about it. You got to watch a million videos and you're still maybe getting it right. So think of it that way. It's like an easy way we can keep our children safe. Okay, last question for you, Dr. Rodesky. How to keep young infants at home safe? Obviously, infants will probably be the last, to receive the vaccine.
Correct.
What do you do in your house if you have older kids, vaccinated, unvaccinated? How do you deal with babies?
So it's the same thing we do for pertussis, which is, a really potentially deadly disease for infants, is that you just get all of the adults and caregivers and other people who are potentially interacting with that infant vaccinated. And so it's about that kind of collective immunity that helps protect that infant. Infants can't wear masks the same way. So there's going to be just a lot of social distancing. And that's hard for moms who want to get together with other moms and get the social support they need. So the more that kind of moms together can be vaccinated and be able to spend time together, I think will also help with the isolation that a lot of new parents have felt during this pandemic.
Keep your bubble vaxxed, and then you can have the mommy and me with the vaxxed circle of trust. I like it. Okay, we are almost out of time, but I want to let you know on this topic that you've just mentioned, our next live event will be on September 14th, and we will be talking beyond COVID, how to avoid and recognize other illnesses in young children. So there's a whole other set of things to worry about. Fantastic. The bad news is that all those other sicknesses have not gone away. The good news is we're here with the facts and the information so that we can all, like we said before, chill with the drama, get informed, and go on living, hopefully, right? Okay, so register for that one at scarymommy.com/live-work-thrive. I want to thank both of our amazing panelists, Dr. Jenny Radesky, developmental behavioral pediatrician and assistant professor of pediatrics. Thank you so much for being here and sharing your knowledge with us. And Dr. Hina Talib, thank you again for representing the American Academy of Pediatrics. I think as a mom, pediatricians are the ones that we've trusted from day one with our babies. So thank you both. It's so comforting and reassuring to hear from two moms who are out there every day on the front lines as we get through this crisis. So I want to thank both of you so much. And as I mentioned, Dr. Talib will be sharing some resources, and Dr. Radesky will share podcast recommendations. Those will be available on Scary Mommy website. Also, if you want to follow Dr. Talib on her fun Instagram handle, it is at Teen Health Doc. Check out her handle there where she shares timely tips and health news. So have a great night, Scary Mommies. This school year will be nothing but normal, but we will get through it because we are moms and together we have each other's backs to live, work, and thrive. Good night, everyone.